Any opening remarks?
Good morning, Chairs Ward and Madden. I'd like to welcome Secretary Kovulich. Seems like we've been spending a lot of time together here lately. And as we expand services, we must be mindful of using and improving existing programs and improving accessibility for our seniors. I look forward to working with my colleagues and the department to further these goals. So thank you.
Thank you, Chairwoman Madden and Chairman Menser, for convening this joint hearing that will give us an update on the status of the Commonwealth's Aging Our Way plan. My co-chair, Senator Maria Collette, will be here shortly. We look forward to that. As chair of Aging and Youth Committee, I've been following the progress of this plan since its announcement. In May of last year, Aging and Youth Committee heard you and Kevin Hancock, who was then the senior advisor to the secretary, give an overview of the progress of the plan, which was then in developmental stages. At that hearing, we noted Pennsylvania currently ranks among the top 10 states in both the total number of older adults and the percentage total state population. And their numbers are growing, as Representative Madden suggested. Our population is getting older. By 2030, 1/4 of Pennsylvania's population will be over the age of 65. Those facts remain unchanged. The Aging Our Way plan will help state government and local governments meet the challenges brought about by these trends. Addressing the needs of an aging population will require a concerted effort and require us to tackle several issues. Just last week, the Senate Aging and Youth Committee reported Senate Bill 840, sponsored by Senator Rosemary Brown, which creates the Alzheimer's Disease, Dementia, and Related Disorders Act. This act will establish the Alzheimer's Disease, Dementia, and Related Disorders Office and Alzheimer's, Dementia, and Related Disorders Advisory Committee within the Department of Aging. The Advisory Committee and Office will work with other state plans which was established in 2013 by executive order. The Advisory Committee and Office will advocate policy measures and work to secure funds to help Pennsylvania meet the needs of those who suffer from these conditions, their family members, and those who provide in both facilities and in home. Pennsylvania has a long and proud history of providing critical assistance to our senior citizens. The Pennsylvania Lottery generates revenue that pays for the free and reduced fare transportation program, the property tax and rent rebate program, and PACE and PACENet, all of which provide critical support to our state's senior citizens. The lottery also provides funds for Pennsylvania's 52 area agencies on aging. Their programs play a vital role in the part of our seniors' lives. The Aging Our Way plan will continue Pennsylvania's tradition of working to ensure that its citizens live with dignity in their communities throughout their lives. I look forward to working with the department as this plan is implemented across the Commonwealth and appreciate the willingness of Secretary Kovulich to appear before the committee, these joint committees, to give us an update on this vital plan. Thank you so very much, and I welcome my minority chair, Senator Maria Collette. Thanks for being with us.
Thank you. Before we begin, I'd like to acknowledge that Representatives Marla Brown, Abney, Powell, and Marcel have joined us. Secretary Kovulich, you may begin.
Good morning. Good morning, Chairwoman Ward, Chairwoman Collette, Chairwoman Madden, Chairman Menser, esteemed members of the Senate, House, and Aging Committees. Today, I'm honored to offer testimony to you on the impact and implementation of Aging Our Way PA, Pennsylvania's 10-year strategic plan for older adults. Before providing an update on the plan, I wanted to take the opportunity to thank this committee's leadership and members of the General Assembly for the support of this effort and for the commitment to the health, well-being, quality of life of all older Pennsylvanians. The successful development of Aging Our Way PA can be attributed to your direct participation, your engagement with your constituents, and your clear desire to make the Commonwealth of Pennsylvania the best place in the country to be an older adult. Our requested investment is paramount to effectively implement the plan and to improve the lives of older adults to live and age well in Pennsylvania. Aging Our Way PA is truly a plan crafted by Pennsylvanians for Pennsylvania. I want to outline the development process to illustrate how we engaged our stakeholders at every step of the way. On May 25, 2023, Governor Shapiro signed an executive order that directed the Department of Aging and their partners to evaluate issues facing older Pennsylvanians to support the development of a 10-year strategic plan. The governor initiated this planning process because we are the 5th oldest state in the nation with a rapidly growing older adult population. Today, 1 in 4 Pennsylvanians are over the age of 60, and by 2030, our 60-plus population will be 1 in 3 Pennsylvanians. These demographic trends are more than numbers on paper. They were a call to action for Pennsylvania to be a leader as the nation grows older and more diverse. We immediately gathered input from stakeholders throughout the Commonwealth, most importantly, Pennsylvanians over the age of 60, caregivers, care partners, and individuals engaged in supporting these populations. Through the 52 area agencies on aging, we held at least one listening session in every county in Pennsylvania, and over 200 sessions in total. We held virtual sessions in different languages, sessions focused on specific populations like the LGBTQ+ community, veterans, and rural communities. We received letters, calls, and emails, and surveyed over 8,000 older adults across the state. The voices, stories, preferences, and needs of these older adults are woven into the development of this plan and reflect its purpose to create a Pennsylvania where all older adults live their lives with dignity and independence. To organize our stakeholder engagement, we use the 8 domains of livability framework. The framework was developed by the World Health Organization and has been adopted in the United States by states, cities, and communities in the AARP Age-Friendly Network. It helps us cast a wide net to understand all the factors that contributing to the living healthy, engaged lives as older adults. The conversations were incredible, honest, and meaningful. They shared their experiences accessing transportation, using sidewalks, engaging with government, and volunteering. They told us about the pride they take in their jobs and their homes, their frustration with navigating services, and their need for trusted sources of information. They shared with us the joy that they get from social activities and challenges of loneliness. They emphasized the importance of maintaining their health, including behavioral health needs and long-term care. They shared their gratitude for paid and unpaid caregivers in supporting their health and independence. We gathered input from more than 20,000 Pennsylvanians. This data was analyzed and processed to identify major themes. We used these themes to draw out 8 summary reports, one for each of the 8 domains of livability. We presented these summaries to the Long-Term Care Council, the steering committee for this plan. The Pennsylvania Long-Term Care Council is comprised of 35 members, including long-term care consumers, advocates, caregivers, providers, and policymakers, some of whom are here with us today: Chairwoman Ward, Chairwoman Collette, Representative Menser, Representative Madden, and former Representative Kim. Thank you for your work in helping us in the steering committee. Throughout the months of October and November of 2023, the Long-Term Care Council worked tirelessly to craft the recommendations that shaped Aging Our Way PA. They received support from the department, additional subject matter experts, and interagency partners to guide them in this process. The recommendations that emerged from the Long-Term Care Council's efforts formed Aging Our Way PA. I cannot express how grateful I am to this group for its commitment to develop these recommendations. The department took the recommendations from the Long-Term Care Council and organized them into priorities, strategies, and tactics that made up the first draft of Aging Our Way PA. The first draft of the plan underwent an extensive review process, and the department worked with the Long-Term Care Council, the plan's 30 partner agencies, and other experts to ensure that the included tactics were practical and achievable. By February of 2024, we were ready to publish a first draft. We published the plan on our website, shared it with key partners, and announced a 30-day public comment period to seek more feedback on how we characterized and translated stakeholder input into action steps. We received more than 800 comments from different organizations and individuals during this time. All of these comments were considered in the revision for the final draft, and new tactics were added in the final plan. On Friday, May 31st, 2024, with Governor Shapiro and aging stakeholders, we celebrated the official publication of Aging Our Way PA. The signing came in just 372 days after the executive order was signed. It was the perfect ending for Older Americans Month. Pennsylvania's plan is already being regarded as the gold standard by partners like the Center for Healthcare Strategies, AARP, and other subject matter experts. Aging Our Way PA is structured around 5 priorities. Unlocking access, make sure that all Pennsylvanians have access to services they need, especially our most marginalized and isolated communities. We make sure that everyone gets to age in a healthy and active way. Pennsylvania's strength is in its diversity, and every Pennsylvania has unique needs and experiences. When someone needs a translator to help them with an application, an accessible bathroom in a state park, or assistive technology to participate in game night at a local community center, we'll make sure that those resources are available to them. Aging in our community enables older adults to maintain secure housing, actively participate in their communities, and ensures that all of us can age as we choose in safe, age-friendly communities throughout Pennsylvania. Older adults are the heart of our communities. They are our volunteers, teachers, coaches, companions, and mentors. We must make sure older Pennsylvanians can keep meeting with family members for lunch, playing pickleball in our parks, and visiting with their friends. Gateways to Independence is about mobility in its many forms. We will make driving, walking, buses, trains, and other transportation safe and easy for older adults to use. From going to the corner store across the street to visiting grandkids across the state, we will make it easy and convenient for older Pennsylvanians to get from place to place. Caregiver support concentrates on several tools and supports to strengthen the paid and unpaid caregiving workforce. We will make sure that people who care for others have the help, training, and rest that they need. As many people on this committee know through their life experiences, caring for a loved one is hard work. We will support our caregivers, paid and unpaid, to make that valuable work more manageable and more rewarding. Education and navigation is about connection and reaching all the community members with our resources and services. We will make sure that information about helpful programs and services is easy for older adults to find. When older Pennsylvanians need help, whether they're navigating insurance claims or finding handymans to fix their sinks, they need information from sources they can trust. We will make sure that these connections are easy and straightforward so that older Pennsylvanians can spend less time on hold and searching and more time doing what they enjoy. Each of the 5 priorities contains its own set of strategies and tactics. These guiding strategies and specific measurable tactics are what will make the 5 priorities real over the next 10 years. In the first year, Aging Our Way PA will immediately support the needs of older adults by improving and scaling successful programs and setting a strong foundation for the next 10 years. In year 5, Aging Our Way PA will build on the work of previous years to develop improved programs that address gaps in the services and infrastructure supporting older adults. We anticipate by year 10, Aging Our Way PA, service delivery, and advocacy networks will be transferred over the course of the decade. We will deliver a system of supports that elevates the aging experience to the best phase of a person's life. Aging Our Way PA identifies numerous preventative services, support structures that will have a long-term financial benefit for both the Commonwealth and its residents. Many of these tactics and investments in existing programs that have a strong return on investment on the older adults and the caregiver population, especially the near-poor demographic that often falls through the cracks of traditional assistance programs. Many of the Pennsylvanians who have participated in our stakeholder engagement were identified as near poor, those who hover above the financial eligibility for public assistance programs, but whose resources do not adequately meet their needs. Without intervention and investment, individuals like these will not be able to sustain the out-of-pocket costs for long-term services and supports and may become eligible for more costly services. This plan focuses on diverting from more acute and costly service interventions to enable older adults to remain active contributors to society as workers, volunteers, taxpayers, and independent community members. This is proactive planning, not reactive, and outlines strategic investment to build better communities based on statewide infrastructures. These programs will yield substantial financial returns, improved outcomes, and reduce the cost over the next 10 years. Rightfully, I've been asked to provide details about the budget request to launch the implementation of Aging Our Way PA. I'm happy to have the opportunity to elaborate on these requested investments. First, the PA Link. The PA Link is our Aging and Disability Resource Center, or ADRC. ADRCs are designed to help persons with disabilities and older adults find information that will connect them to supports and services in their community. Simply put, it's navigation. Many community members do not know about PA Link, and it's seldom the first place older adults and caregivers look to find help. The funding we are asking for will allow us to thoroughly redesign PA Link to incorporate a no wrong door principle so that consumers are connected to navigation services that they need. The redesigned version of Link will provide a highly visible, reliable, and universal access point to aging and disabilities-related services. Caregiver supports remain a central theme to our plan. According to AARP, nearly 1.5 million unpaid caregivers across the Commonwealth are caring for loved ones at an estimated value of $22 billion. They are caring for someone at home, coordinating appointments, or attending to one of the countless duties that a caregiver does each and every day. They are vital to our system and need access to social, emotional, and respite resources and supports. The funding we have requested will be used to develop a statewide caregiver toolkit and recruitment toolkit. In our stakeholder engagement, we heard from people who provide care and people who rely on care, and they have told us that caregivers need help. The funding will enable us to provide support for paid and unpaid caregivers, including information, training, respite services, and resources for families to evaluate and select safe and reliable caregivers. Providing much-needed support for caregivers is a common-sense investment with significant returns in both cost savings and quality of life. By preventing caregiver burnout, we can keep more people out of facilities, lighten the burden on home and community-based services, and keep people out of protective services. Next, we have tools to enhance our aging network. We are fortunate to have 52 area agencies on aging. The benefits of their hard work have already been mentioned numerous times throughout today's presentation. As the population they serve grows and changes, the aging network needs tools to continue to engage with all communities. Through the investment outlined here, we will support them in that work. We will create accessibility guides that will standardize the way aging networks communicates with the entire community and ensures that people who are visually impaired and hard of hearing have consistent statewide access. We will also develop a volunteer toolkit that will help our aging network partners maintain and strengthen the workforce by attracting, recruiting, and retaining candidates. Volunteers are vital contributors to our aging network. 11,202 volunteers in Pennsylvania provide 150,000 volunteer hours annually, saving the Commonwealth an estimated $5 million. The volunteer workforce outnumbers the paid workforce 4-to-1. We cannot do this work without them. These numbers demonstrate the value the Aging Network volunteer programs already bring to the Commonwealth. Investing in their ability to maintain and strengthen these programs will ensure the continuous recruitment and retention of volunteers for years to come. We ask for investment in what we call connection, not crisis. Many community members are unaware of the Aging Network until they are facing a crisis. We must do a better job proactively connecting older adults to this network. The projects outlined here will help us make those connections and understand how we can improve our engagement with more communities like veterans, rural older adults, and those who speak languages other than English. These funds will help us understand and reduce barriers faced by marginalized and minority populations and cultural and language groups. By investing and reaching these communities proactively, we can help avoid facing more costly, significant challenges down the road. This funding will also supplement our partnership with the PA Emergency Management Agency, as we work together to improve how we connect community organizations like volunteer fire companies and places of worship to support neighbors in everyday crises like pipes bursting and fires and severe weather situations. Accountability and program evaluation will help us to ensure that the plan stays relevant and innovative and that it delivers real results. Comprehensive evaluation will help us measure our impact and direct our investments. This will ensure that we are accountable with the valuable resources provided to implement the plan, as well as all of the program services and resources that we currently provide. The success of Aging Our Way PA is dependent on the coordination and collaboration of our sister agencies, private stakeholders, and all communities across the Commonwealth. Everyone has a role to play. The department pledges to conduct regular data monitoring, track our progress, highlight impacts through a publicly accessible dashboard. Just as we kept our stakeholders at the center of this plan, we continue to engage older Pennsylvanians, caregivers, care partners, providers, and experts to ensure that the plan stays relevant and effective. We are forever grateful to the leadership and members of these committees for their support of this effort in developing Aging Our Way PA. Thank you for all you do to support the health, well-being, and quality of life of older adults all across the Commonwealth.
Thank you. Okay.
Good morning. Thank you so much, Secretary Kovulich, for being here. I don't have to tell you, you know, I am thrilled about this plan. I have been from its inception, and I'm very excited to, see all of your hard work coming to fruition. And I'm really hopeful that we're going to be able to support the governor's budget request to make sure that Aging Our Way goes into effect the way that you envision. And, as you were talking, there were two things that really stood out to me. Number one, when we talk about caregivers and we talk about, and you said, I wrote it down here, the help, training, and rest that they need. And I'm wondering if you can elaborate a little bit more on how we make that a reality, especially as you know, when long-term care facilities are struggling. And so respite care sometimes might be out of reach. And then the other question I had for you was in terms of working with those long-term care facilities, and especially as you talked about the near poor populations that we want to make sure don't fall through the cracks. I think that, as we see more and more facilities closing, struggling with those Medicaid populations, I'm wondering if you can talk a little bit more about the partnership that you envision through the Aging Our Way plan to make sure that we have the supports we need. It would be wonderful if everyone could age in their home, but we know that that's not always the case. So if you could talk a little bit about how you see that intersection to make sure that our near poor don't fall through the cracks, and also helping to understand how we partner with long-term care facilities to provide that respite care as needed for caregivers. Thank you. Thank you, Madam Chairs.
Thank you. That's a great question because it really highlights that all of the work that the Aging Network does is connected in every form. There's no buckets, there's no silos in aging. What one side of the office does affects what the other side of the office does, and what we do when we first meet an older adult and what we do when we have to see an older adult move into a higher level of care are all connected. What we concentrate on in Aging Our Way PA, specifically around the caregivers, is supporting them in what they've told us that they need. One, they need to get their questions answered. So while we're proposing investment in navigation, we're also proposing an investment in a toolkit so that they can make sure that they know how to access these resources quickly and easily. The toolkit also contains strategies on how they can de-escalate situations, understanding behavioral health, examples of making sure that we prevent burnout, and because people have good resources. By preventing burnout from caregivers, one, we don't see people move more quickly into a higher level of care that they may end up being in someday because of a medical necessity, but we make sure that their caregiver has the support, the peer support, the local support to stay focused, to stay caregiving. We know that they're spending somewhere around 21 hours a week. It's a part-time job that's not paid for in most instances, taking care of a loved one. We need to make sure that they are recognized and that they're supported, that they feel that they can go get their haircut, something that's simple. Go to a family wedding without having to worry about how the care of a loved one is going to be taken care of. So supporting networks that we already have in place in the caregiver space, the adult day centers that can provide respite in those situations, or other programs that we can make sure older adults spend time in so that the caregiver gets a break, impacts the whole entire continuum of aging services. The toolkit is essential for us. The toolkit's essential for caregivers. We know that they've asked us for this resource, and it has to be easily accessible and findable. It can't be something that's hidden away in an office. It has to be something that someone can click on at night at 9:30, 10 o'clock at night when they're searching the web for an idea how they're going to take care of their mom or dad as they become progressively worse. And that's the reality. So that caregiver toolkit is essential. That's the essential investment, but also making sure that, as people do move into higher levels of care, we find other solutions besides moving right to a facility. Keeping people in communities longer is more important. I've already mentioned adult day centers as a way of doing that, but also being able to supplement the work that an unpaid caregiver does with our caregivers that are paid. Through services like the services offered in the options program through the Area Agencies on Aging, can help us push that time back in which they would go to a facility. So all of this work is connected, and the caregiver theme is everywhere in Aging Our Way, from transportation to housing to support services to the toolkit. So we do have to highlight the fact that it is one of the most important and critical investments that we're asking for, is to support the work of paid and unpaid caregivers. And as far as paid caregivers are concerned, looking at the Long-Term Care Council's direct care workforce plan that has long sat on a shelf, and putting that to work with the Long-Term Care Council to make sure that it's going into action to recruit and to attract good workers into the direct care workforce, but also giving that peace of mind that older Pennsylvanians have asked us for, a way to determine that the person that's coming into their home to give them a bath or to give them some assistance is safe and reliable, which is something that's sorely needed and something that's missing right now.
A couple thank yous. First, thank you so much for the work that you've done on this plan. I think it sends a message to our Pennsylvania residents that this is important. This is important work, and caring for our older adults is important, and it's a priority to us. So I want to thank you for all the work, and it's been just such a pleasure to work with you on this. Last week, the Senate Aging and Youth Committee unanimously reported Senator Rosemary Brown's bill, Senate Bill 840, which creates the infrastructure necessary for Pennsylvania to address the expected increase in cases of Alzheimer's disease, dementia, and related cognitive disorders. I just want to thank you for the work that you did to help us get to a good place on the bill. The plan references the establishment of the office created by the bill, and it's my hope that the plan administrators will work with the infrastructure that was created in the bill to prepare Pennsylvania for the increase in residents who suffer from one of these conditions. So it's my hope, that that's going to go well and work out the way that we had intended it. Just a question. My district is very rural, as you know, and with many older residents living in areas that are not served by mass transit systems. It's a serious challenge for residents when they're no longer able to drive. So providing transportation services to these areas is very expensive and often difficult. The plan touches upon this issue, but for the committees and the folks at home, could you further give us a little more detail in how the plan would help these rural Pennsylvanians retain their mobility and independence?
Thank you. And I was fortunate throughout the stakeholder engagement to be able to go to so many of our more rural counties and engage with the older adults directly and hear from them these challenges. Just yesterday I was in our service area is Washington Fayette Green. So that service area really struggles with rural transportation challenges, and the director there and I have had many conversations about this, and that's why transportation will never be a theme that goes away from Aging Our Way PA. In the next 10 years, it will be constantly discussed and refined and talked about, and that's why this is a living document and a living plan. It's not going to be stagnant and just sitting on a shelf. It's something that we have to continuously work on. But we also have to become more creative because, like you said, it is costly to build out a shared ride program in these communities, and they don't necessarily have the resources and infrastructure to do that. So working with specific local communities and the flexibility that we have in the Aging Network, we can take resources and find new solutions. Maybe it is something where we have to look at volunteers to help us drive. There's many communities that use volunteers, the villages in southeast Pennsylvania, for example. All of their transportation needs are met through other volunteers who live in those villages, coming together to make sure that their friends get to appointments, get to see their loved ones, get to see their grandkids. It's not all about medical. It's about real life things. It's about getting your haircut. It's about going to CVS. It's about going to, it's what we need to make sure people can do so they can stay in their homes longer. Those are the real challenges that we're trying to tackle. We're not pretending that the answers are in the plan, but what the plan does is it convenes people. It gets our partners at PennDOT back to the table with us, with local communities, with local community leadership too, working on these problems. We really do need to solve the rural transportation crisis as most of rural Pennsylvania ages more rapidly than some of our other parts of Pennsylvania. And it's really something that we have to do in a very all hands on deck type way. So I think there are plenty of solutions out there, but they're unique to every community. The importance of the plan is that the plan calls people to action to sit down and work on these issues together. And it may call for more resources at some point, but right now the first part of the process is getting people aware of what's out there that they can already access, and then helping us assess where the problems are so that we can move forward and find solutions for those problems.
That's wonderful. Thank you. And I think just calling attention to the issue and then calling people to create their own solutions in their communities is great. So thank you very much.
Thank you, Mr. Secretary, for that thoughtful and comprehensive description of explanation of Aging Our Way. As you know, our 52 areas on aging work diligently to provide services for our seniors, transitioning them to Medicare, protective services. How will this plan help them to be able to provide those services?
Thank you. As a former AAA director, I can tell you every part of this plan benefits the work of the area agencies on aging. There's nothing in the first year that is being asked for that the area agencies on aging aren't already doing. The area agencies on aging are helping with caregivers right now. Right now, they're helping connect people to resources. Right now, they have people walking into their offices that are asking for assistance that they can't necessarily assist because they don't have the technology or the support or the tools to help those individuals. This work is continuous, and it's a continuum of work that the area agencies on aging are doing. And a lot of the work, you mentioned protective services. Just for example, the work we do in caregiver space to prevent burnout helps us prevent protective service incident down the road. The tactics identified and informing people about financial exploitation in the first year helps us to identify and prevent people from moving into being financially exploited. Also, when we talk about the financial exploitation, the second, and then the other biggest protective service issue is self-neglect. Self-neglect often comes from people not knowing what's out there to help them. The navigation services that we are proposing to enhance that do exist already will help those individuals to access services or help access resources in the community that can help prevent them from becoming a self-neglect case down the road. All of this work is interconnected. All of this work impacts the 52 area agencies on aging. Everything that we're asking for makes a AAA director and the staff, more importantly, who are in the field every day, makes their work more doable, makes them feel supported, and makes them help that older adult in a better way that keeps them from something that could be a much more costly service intervention down the road.
Thank you for that explanation. Chair Menser, did you have any remarks?
Thank you,
Questions?
Chair Madden. I appreciate that. And Secretary Coolidge, the $11.7 million is a one-time expense. This is not a reoccurring expense. Is that a good assumption?
This is thank you. This is an initial investment. So this $11.7 million is our initial investment in moving forward. Based on what we receive in this ask, we can possibly unless we know what we're going to receive in this ask, we can't project what we would need next year to continue. But there will need to be continued investment in aging services to meet the growing needs of older adults. It is the largest growing population, and we will continue to have needs for them. But as of right now, the 11.7 is our first ask for an initial investment to help us jumpstart our system to meet the current needs of older adults, because basically we haven't had an investment really to tackle this issue since Governor Corbett was in office, and we really need to get caught up in some ways to make sure that we can meet the needs of this ever-growing population for now. And then when this population does level out, and we can project that safely with the numbers that we have, then we will have to look at our resources and consider the changes that we have to make as the need from the area agencies on aging, as the need for aging services shrinks in those years.
Okay, and a lot of those expenditures in the future will be in other areas of the budget, like human services. So I guess what I'm suggesting is, the $5.5 million to refresh PA links, that's just a one-time expense, I would assume.
The $5.5 million for Link right now, it covers the tactics that we have asked for in that, but there will need to be continuous investment in Link. Link has been around since 2011 with no investment in it. It is a state match to federal dollars, and it's become less and less used as time has gone by because we haven't put resources to it. So Link will not necessarily need 5.5 million every year, but Link will need continued investment to stay active, relevant, and effective for older adults.
Okay, and so do you foresee then that there's going to be every year an additional line item for Aging Our Way, or will that find it?
I think, as this population grows, there's always going to be growing need. So until the population changes, I don't think that we're going to see the end to the needs that we have for older Pennsylvanians. I think it's not, it would not be logical for me to say that we'll level out and, as this population is growing. There will be need. We will need to enhance services. We will need to invest in new technologies, new ways of helping people to prevent them from going to higher levels of care. That's what we exist for, is to keep people from that higher level of care and keep people in their communities.
Thank you for that. So, for instance, the caregiver toolkit. You make one investment in the caregiver toolkit, and that caregiver toolkit, we don't have to produce another caregiver toolkit, next year.
No, but the steering committee and the long-term care council may think in year 4 the caregiver toolkit needs an update, and then we will update the caregiver toolkit and ask for more resources.
Okay.
So you are correct. The toolkits that we asked for are initial investments. They are one and dones, but they will probably need to be updated in the future to keep them relevant and keep them useful.
Thank you very much, Sec.
So.
Thank you. We have questions from a number of members. We'll start with Rep. Schlegel, and then we'll go to Representative Gleim, Representative Cooper, and then Senator Collette again.
Thank you, Madam Chair. And Mr. Secretary, could you do me a favor, please, and move your microphone just a little closer to you? I appreciate that. Thank you very much. During the House budget hearings last March, there was a discussion regarding the collection and transparency of data pertaining to elder abuse investigations. Does the plan address improvements with respect to this issue?
The plan does ask for resources to help us become more transparent. Yes, we want people to see the work that we're doing. We want to be transparent. We want to have dashboards so that individuals can go online and see this work. Last week, we met with Representative Schmidt about supporting how we could do this and how we build this out to make sure that the department's being totally transparent. There is no reason for us not to be, but it takes time and it takes resources for us to do that effectively and correctly. And part of our ask is to help us build that platform out so that the public and everyone can see the work in real time.
Thank you very much.
Representative Gleim?
Thank you, Madam Chairman, and thank you for being here today and testifying. My question actually goes along the same lines as Chairman Menser's. Will the additional resources in the request for funds in the plan reduce the costs on the spending diversion page of the presentation, or will any of this help reduce those costs?
Yeah, the short answer is yes. The whole purpose of what we're doing here is to keep people out of more costly service interventions. By keeping individuals in their homes, in their communities, with the kind of supportive services that they need, we prevent them from higher levels of care, from going into higher levels of care. That is our sole desire, that is our sole intent with making sure that this plan is successful. So supporting caregivers, for example, and supporting navigation services that we talked about today prolongs people living in their communities, and hopefully they will never have to move into a more costly level of service intervention.
Okay, thank you. And then just to follow through with that is there's a number of the action items in the plan that involve numerous state agencies like Human Services. And so what kind of outreach do you intend to do with respect to the other committees in the General Assembly?
Well, thank you, and I'm really happy that you highlighted the work, because much of the work that's happening in the Commonwealth right now, that's already been funded, that's already happening right now as we're talking, helps older Pennsylvanians. We're just not making the connections. So I use, for example, Secretary Dunn, because it's not apparent to all of us in a lot of ways that older Pennsylvanians are the largest consumers of our PA State Park system. But the work that our department is doing is enhancing restroom facilities and making sure that they're accessible to older adults and those that are differently abled. So just connecting and showing that that work has already been invested in by the General Assembly and that it's happening in the state really highlights to older Pennsylvanians that older adults are at the center of the work that we're doing, that we are cognizant that they have needs, and that we're going to continue to provide for those needs. We're just not in many ways giving ourselves credit for the work we're already doing. Our department as a convener will help bring those resources out into the forefront and show the work that's being done by departments like I just talked about, and by departments like the Department of Economic Development. Every time we do a Main Street over in Pennsylvania, we make it better for an older adult to get from one point to another with better sidewalks, with better lighting, things that they've asked us for. We're already doing. We're just not giving ourselves credit for the work that we're doing.
Thank you. Representative Cooper?
Thank you, Madam Chair. Mr. Secretary, thank you for your testimony. I'm a freshman here and new, and I asked to be on the Aging Committee because I went through my mother aging and staying at home, and it was all learning all the new services that are available. It sounds to me like you have a lot of experience in this area. So my question is, when this plan was put in place and you reviewed it, what did you see that was different? Like, what surprised you? I mean, because you've been in this area for so long, and then we just did this comprehensive plan. And so can you share very specific that surprised you in a direction that we are taking differently than what we were based on the data that was collected?
Thank you. And I want to highlight the reason why our plan is being celebrated is because of how we engaged with stakeholders. We went out and we listened to older Pennsylvanians. This wasn't developed in a back room at the Department of Aging. We went out, we listened, we talked to people, we made sure we had real life feedback and that their voice was woven into this. And I will tell you honestly, after 25 years in this space, the thing that really took me by surprise the most was older adults telling us we need better behavioral health services. And this plan works with our sister agencies, works with our partners to help build out better community-based behavioral health services that directly benefit older Pennsylvanians. Something I never would have thought would be highlighted, something I never thought they would have brought up to us. Came directly from older Pennsylvanians saying, we need help with this. We don't talk about the high suicide rate for older men. That's one of the highest in the nation. And we don't talk about 988 services. And we don't necessarily, through our LINK program or other programs that aren't widely known, make sure that some behavioral health services are easily accessible. When an older adult calls for behavioral health services, they struggle because so few behavioral health partners accept their Medicare. And the Medicare lists are very long for the providers that do accept it. So by having better navigation services, by working better with our sister agencies, we hope to be able to connect those resources to the older adults who have asked us for them. So, I mean, the one thing in my professional opinion that took me the most by surprise was that request.
Thank you. And then the other question I have is the LIFE program. When I was going through this with my mother, I thought I was searching and trying to find everything that would have been helpful. And I never was able to come across that. So, I mean, I feel like it's a great program because it allows elderly people to age in home and there's services that are there. So what are we doing differently to promote that program?
Well, LIFE and adult day centers, I agree with you. They're some of the best programs we have in the Commonwealth. And, not to boil this down to numbers, they're exceptionally cost-effective programs. They're good programs for the recipient. They get incredible care. They have all of their needs met, and they get socialization. The list of positives are unbelievable. And It's good because of the staff to person ratio, because it helps us, keeps life and adult day centers staffed and working so that we can serve a larger number of consumers with those individuals in a very good way. Really, what we're asking for is the resources to build out navigation services so that individuals who are searching get connected to adult days, get connected to life programs much more easily, that they can set up a tour much more easily, that they can understand the work that they do so that their loved one can benefit. It is a tremendous service model. Both of those models, they're very mirrored, and we really don't talk enough about it. I testified to this earlier this year before the House Committee about the importance of adult day centers and life programs, and that we have not really highlighted that as a solution as much as we need to. And I appreciate you bringing it up because it is a great solution for Pennsylvania.
Thank you.
Thank you. We're going to go to Senator Schwenk for a question.
Thank you, Chairwoman. Thank you, Secretary Kovulich. I can't wait to get through this plan. It's really comprehensive. There's a lot to gain here. And I think based on what I can see and inherent in what you've been talking about, we're talking about a population from the ages maybe 60 to 100 plus. That's a long period of time that we're talking about in terms of planning for, and a very, very diverse audience. I'm sure you would agree in terms of the services, the needs, or how you ease people into acquiring or accepting the services that are available to them. So 2 questions for you. One is, oftentimes when, we focused a lot on when people need to get into having a caregiver or, getting rehabilitation or something of that nature. That often happens after a senior has a surgery, post-operative. You can't necessarily go home, but you do need some care before you can go home. How do we communicate that, what the resources are available to the medical professionals, for example, at the surgical centers or hospitals, and the social workers? I, recently have experienced this with a former employee who is, trying to navigate that post-operative care, but she definitely wants to go back to her home. How will we be able to communicate with those folks?
Thank you, and that really highlights one of the toolkits we ask for in the first year. And as an area agency on aging director, I can't tell you how many times I went to meetings and was said, we didn't know you did that, or we didn't know that was out there, or I didn't make the call because we could have set up services before my loved one went in for surgery and then needed rehab and then needed assistance when they came home. So the toolkit we ask for helps medical providers, helps other social service professionals, but also helps constituent services. Please don't think that the fact is lost on me that a lot of my time when I was a director was helping our constituent service offices connect people that walk in. I know that older adults walk into constituent services offices more frequently than other people off the street, and that your teams on the ground really need the assistance, and that's what we're asking for, making sure that they understand they have toolkits that they can easily solve a problem on the ground or connect people to resources at the area agency on aging quickly in an informed way so that the older adult gets that care in advance and makes a plan in advance. I've seen too many times someone coming out of rehab then struggling when the insurance stops paying for that in-home service, that in-home nurse. They only get so many visits, and then they need more personal care assistance. Getting that set up early and finding options early for that person's critically important, but also doing things like simple things like setting up meal services, okay? Sometimes they need that as a respite, and that helps their unpaid caregiver on the other end by having a service set up before mom or dad comes home from rehab.
Thank you for that. And just, if I may ask another question, you talk a lot about the folks that will serve as volunteers. How will we communicate to them? How will we, advertise the fact that we need their services? This is a way that you can give back to your community. How will that be handled within the plan?
And that, thank you. And that is why we are building out a volunteer toolkit, because I can tell you in firsthand experience that that's hard when you're running an agency, when you're handling all that you do every day, but making sure that you're building that volunteer network, making sure that you're meeting the needs of your volunteers is critically important. Think about what our prize program does. No one has the expertise to help someone fill out the most complicated form in history, in my mind, for Medicare Part B. Prize volunteers do that every single day, and they are volunteers, they are good volunteers, they're educated volunteers, and without them, our system could grind to a halt. And that's why the toolkit helps us recruit, helps us understand retention, helps us understand expanding so that we can keep that volunteer base solid. Same thing with ombudsman services. We would not have ombudsman as robustly across the Commonwealth without the volunteers. They provide almost $320,000 worth of services for free for us every year. It's something that we have to continue to make. This, in my mind, is a small investment for a big return.
Thank you.
Thank you. Senator Collette?
Thank you, Madam Chairwoman. I just wanted to circle back to what Chairwoman Ward was talking about with regard to transportation. We had an opportunity to meet with some SEPTA representatives earlier in the week, and they talked about, these changes to bus routes. And I know that you have been working with them and working with all of our transportation authorities around the state. But I guess, my question really is in terms of advocating for I get it that we can't have a bus stop at every corner, right? That, sometimes you need to go 3 blocks, but for some of our elderly neighbors, it's not easy to go an extra 3 blocks to get on a bus to get somewhere. So I guess my question is, in your communications with SEPTA, and I know that their plan is fluid as well, so I'm glad to hear that Aging Our Way will evolve as needs change. My question to you is with regard to your conversations with SEPTA, where are you on advocating for those bus route changes that will have the least impact on aging folks in the Southeast?
Well, thank you. And that's where the department becomes, that's the wonderful thing about our department is we work with the 52 area agencies on aging, and they really have the biggest voice in this. Helping them stay connected to SEPTA is the first part, and stay at the table with SEPTA. The department can come and have conversations with SEPTA, but we are one step too far removed. We need to make sure that we're empowering and giving resources to the area agencies on aging to be at that table, because they understand the people that they serve in that community better than we do. I have a great understanding of how we serve older adults, but I can't tell you how exactly the older adults in Bucks County need to be served without my area agency on aging giving me that information. So I want to make sure that we are giving the resources to our teams in the 52 to make sure that they can be at the table, that they can have the conversations with SEPTA. And a little known fact is that every one of our area agencies on aging does take resources from their annual budget and contributes it to transportation in every one of our service areas. So in addition to the resources that we see PennDOT having to help older adults with transportation needs, all of our area agencies on aging are expending resources to help meet older adults' transportation needs too. So that gives them a stake at the table as well.
Representative Nelson.
Thank you, Madam Chair. I really appreciate, the testimony. Definitely a lot of effort has gone into developing the plan. I guess some of my concern is in the area of priorities for the investment. I'm a Southwestern Pennsylvania. We just had announcement 21, the bankruptcy of 21, facilities, about 2,600 beds for seniors. Earlier, the Representative Cooper mentioned about the LIFE program, and I completely agree, singing the praises of our AAAs, who really are doing a large portion of this work. So the $12 million that would be invested here, I wonder, in your opinion, do you feel there are higher priorities of investment or ways that, because there's a lot of needs in this space, so when we're saying now 1 in 4, soon 1 in 3, is this the best way to spend that $12 million.
Well, thank you. And, I came here to do better for older Pennsylvanians. Okay, that's what I come each and every day to do. And if we didn't believe that this 11.7 million was to benefit and do better for older Pennsylvanians, I would not sit here and ask for this resource. I would say this resource should be spent elsewhere. I
guess just to clarify, so if we were sending $12 million to our AAAs, and I picture, what a great shot in the arm, or that LIFE program that I think almost for decades really hasn't received an increase at all. Is this program a more important investment, in your opinion, than a larger investment in the AAAs or expanding the LIFE program? Because we just unfortunately can't do all.
Well, this is an investment in the AAA system. The 11.7 million primarily benefits the work that the AAAs do. This enhances their work. The work that we're asking, or the resources that we're asking for, builds on work that they're already doing and gives them tools to do it better and more effectively. That's what this 11.7 million does. There is a component that asks us to be more transparent and evaluate ourselves better. Yes, that is in the $11.7 million ask. But everything else in this ask is to benefit the work that AAAs do. So the 11.7 million primarily is for the AAAs, and for us to be able to show you at all times what the resources are doing, how the resources are performing, and if we're making the mark. That's what I'm sorry that I'm not doing a good job of it, but I've been trying to convey. This investment is not in the Department of Aging. This is not in resources to go elsewhere. This is a resource. These are resources that me, a year and a half ago as a AAA director needed to do my job better every day, and my teams in the field needed to do their job better every day to keep people out of more expensive services, and to make sure that they use programs like adult day centers effectively to keep older adults in their communities where they're happy.
Okay. Thank you. Thank you, Madam Chair.
Thank you. Are there any other questions? Okay, seeing none, we'd like to thank you all for being here, and thank you, Chair Ward and Colette, for joining us. For my colleagues in the House, this is a reminder that the Aging and Older Adult Services Committee will be holding a voting meeting in room 523 of the Irvis Office Building at the call of the Chair. Thank you again. Thank you, everyone, for attending. The meeting is now adjourned.
Thank you.